In today's video, we will discuss about gene therapy. This particular topic will be asked very often in paper 1 of internal medicine MD examination. And even recently in January 2025, again paper 1 of MD general medicine, this question is being repeated. So you will understand regarding this gene therapy in today's video. First of all, gene therapy will alter the genetic expression of cells to treat or cure some diseases. Majority of the times what happens is, whenever we plan for treatment for any disease, we will be mainly focusing upon the symptoms. So we will be mainly targeting about treating symptoms or doing some surgical procedures to manage those symptoms. Genetic therapy will directly target the root cause, that is mainly the genetic material DNA or RNA. So this is how it will function. Not just focusing upon the symptoms, it will focus mainly on the root cause. Then we have to know about the various methods of gene therapy. For the better understanding of this, I just want to give an analogy. For example, we will consider the watch as the genetic material. Now, because of some issues, the main dial of the watch is not functioning properly. So in that case, we need to replace this non-functional dial. So what we will do? We will be replacing this one with the properly functioning dial. So that is called as gene replacement. Here, the genetic material part which has become non-functional because of some mutations and all, we will be introducing a healthy functional copy of gene in place of that. So this is gene replacement. Now we will focus upon the other method, that is gene addition. Now suppose just imagine the same watch. We have got the belt, but there is no dial part which is actually missing. So what we need to do? We just need to insert that particular part. This is called as gene addition. So introducing an entirely new genetic sequence into the already existing genetic material of the body. This is gene addition. The other modality is called as gene knockout. So what does that mean? Suppose this entire watch has developed some of the sharp structures over it which are causing repeated harm to our wrist or the hand. So what we need to do? We need to eliminate such harmful functions to protect the body. In the similar way, in gene knockout, the process involves inactivating or silencing a mutated gene that is functioning improperly or causing toxicity. So these are the three modalities of gene therapy. Now once we got to know regarding the various modes, now how to insert the new genetic material during gene therapy. There are two major ways to deliver the genetic material. One is in vivo, another one is ex vivo delivery. So in vivo, genetic material is injected directly into the patients. For example, some subretinal injections or even intravenous injections. So here the genetic material will be directly injected into the body. Whereas in ex vivo, we will take out few of the cells from the body of that individual and they will be genetically modified in the laboratory. Then they will be reinfused again. So this process is called as ex vivo delivery system of gene therapy. Now we will see what are the common disorders which will be treated using gene therapy. When it comes to neurological disorders, mainly some degenerative monogenic inherited disorders like spinal muscular atrophy, which will be caused by the mutation of SM1 gene, leading to severe degeneration of motor neurons. So in this case, gene therapy is utilized and the name should be remembered, that is Zolgensma. It is one of the most important treatment option when it comes to spinal muscular atrophy. And just to enlist some of the similar disorders where gene therapy will be helpful are severe combined immunodeficiency and cystic fibrosis as well. And this modality of gene therapy is vastly utilized nowadays when it comes to hematological malignancy and cancer immunotherapy. So here, in some malignancies such as refractory B-cell, acute lymphoblastic leukemia or even diffuse large B-cell lymphoma, we can take the help of CAR T-cell therapy. So here, as I mentioned, the ex vivo method of gene therapy will be followed. So the T cells are taken out of the body and they will be attached with the chimeric antigen receptors. Overall, it is a kind of modification in the laboratory and these cells are harvested and again re-injected into the body of that individual, targeting refractory malignant cells. So this concept is very, very important and sometimes this CAR T-cell therapy itself can be asked as a 10-mark question. The other conditions where gene therapy is utilized are some inherited ocular dystrophies like retinal dystrophy, where the biallelic mutation in RPE65 gene will lead to progressive photoreceptor degeneration leading to progressive blindness, and in that case we can take the help of gene therapy. And in this particular condition, this can be injected directly in the subretinal layer. So subretinal injection, which is considered as one of the easiest accessible site in the body, as well as it is immune privileged site. So the success of therapy will be quite higher. And commonly in some hemoglobinopathies like sickle cell disease or beta thalassemia, where again mutations will lead to beta globulin chain dysfunction affecting the structure of RBCs. There also we can take the help of gene therapy. And to enlist few more such disorders, demyelinating conditions of nervous system like leukodystrophies, mainly metachromatic leukodystrophy, a rare lysosomal storage disease caused by enzyme deficiency leading to toxic buildup of abnormal materials and demyelination. So in that case also we can take the help of gene therapy, which will lead to remyelination of the myelin sheath. So overall, just to enlist, we can say it is useful in many neurodegenerative diseases, inherited retinal dystrophy cases, monogenic inherited disorders like spinal muscular atrophy, even hematological malignancies and some hemoglobinopathies. We can use gene therapy. So the same disorders are being listed out here. You can just take the screenshot of this slide. And similarly, we have to know what are the limitations of this wonderful technology. The thing is, when we are inserting the genetic material, there will be risk of integrating viral vector which might abnormally activate oncogene, or it might suppress tumor suppressor gene, leading to abnormal proliferation of the cells. So this is one drawback we can consider. And many a times there might be chances of immunogenicity, that is, the patient's immune system recognizes the viral vector as foreign body and it will try to neutralize the therapy or trigger severe inflammation. This will lead to failure of the target, as well as there might be some adverse effects because of such severe inflammation. And of course, when it comes to the cost effectiveness, the manufacturing complexity make these therapies exceptionally expensive. So it is quite difficult to make this particular therapy globally accessible. So after spending so much of the expenses, if the vector when enters the bloodstream and it is being recognized by our native antibodies as foreign, and if they try to destroy or neutralize that before even it reaches the target cell, it will be entirely useless. But still, why so much of research is going on this aspect is because it can rewrite the future of medicine. For example, from management to eradication, shifting clinical focus from suppressing symptoms to fixing the root genetic cause. And the versatile architecture of this particular modality of treatment in numerous disorders ranging from ocular, blood related disorders, spine and immune system related disorders. So it has a vast impact on various systems of the body. So if the manufacturing complexity is standardized and if we overcome this vector immunogenicity, there might be very high chances that this mode of treatment will be a game changer in numerous disorders where we think there is no actual cure. So this was in brief regarding gene therapy. Share it among all the exam going candidates so that you can make the notes of this short topic, because there are very high chances of repeating such questions in upcoming exams. See you in another video. Till then, read well. If you have any doubts, please put it in comment section. Thank you.